Society for Family Health is a non-profit, non-governmental provider of health products, services and health communication.
We do sexual and reproductive health education in schools and in communities, and a big part as well is medical male circumcision.
One of the reasons why we embarked on this project is that the research that was done in the 3 countries had proof that circumcision can reduce the HIV infection by 60% in men.
The idea behind the I Choose campaign is that this message of I choosing is quite relevant, and we found quite a good insight in terms of what men, especially in communities that are generally low income.
So as a program, I think we are at a point where we realize that we need to put more stringent measures to do demand creation.
We needed a partner who would be able to understand how to deal with men, firstly, and how to speak to a man about, changing his behavioral issues and potentially access MMC at the end of the day.
We brought in Live Moya and Footballers for Life. They have in the past been pretty successful in creating demand for other services such as HIV counseling and testing.
And we were working with an organization that understood what it took to create demand and implement that behavioral change strategy.
Live Moya was contracted by SFH to assist them in their MMC mobilization efforts in order to help them reach their MMC targets.
What we did is, in partnership with Footballers for Life, was actually come up with the I Choose campaign.
In this I Choose campaign, Live Moya collaborated with us, Footballers for Life, as site leads to ensure that the day-to-day running of the program is a success.
We established community-specific social mobilization approaches. And this was very important because it allowed us to address the barriers that were specific to a particular area, a particular community, a particular culture.
As Footballers for Life, because we're using our status as footballers, we came in here because we knew that people are going to listen to us. They will be excited to see us coming back to the community, giving back to them. That also helped us, and also we used our mobilizers because they are coming from the very same community.
So you are willing to go where you see?
Yeah, I'm willing to man because I don't want to feel I'm when you start.
I'm going to start, yeah.
Yeah, I'm going to feel that they can pass me in the teams.
Oh, you know,
yeah, I'm going to feel that I'm not going to canceling.
Yeah.
When you go on and then you go on and
yeah.
A fear of pain. So men fear the actual procedure of having their foreskin cut off. They also fear the needle prick.
It really takes some convincing to make someone understand why it'll benefit them to, let go of their foreskin and access these services.
When you get them to their individual spot where they are comfortable, their comfort zone, that is where you are able to engage them and you address their fears, you address their worries and their concerns, and including the myths, especially about circumcision.
There's still a lot of myths around MMC, and particularly about what time of year can you get circumcised.
Sometimes it becomes tough, sometimes it becomes easier because abantu basizina-belief ahlukahlukene. Abanye basabelieve ukuthi circumcision yenziwa ebusika, abanye basabelieve ukuthi circumcision ayenziwa ehlobo, abanye babelieve ukuthi mawenze i-circumcision there are chances ukuthi ungagcina ungasavukela kanti konke lokho akukho.
Ni mobilizer ye I Choose Circumcision yangitshela tonke tintfo lebekufanele ngitati about i-circumcision. So that is why I took the initiative namuhla ukuthi ngihambe ngiyo-circumcise even though kungasisebusika kusehlobo, because it doesn't matter ukuthi ihlobo noma kusebusika ukuthi circumcise.
Older men are not easy to come by or to convince to come through to services. So what we're doing now is looking at hostels whereby we know it's concentrated with men.
We are here today at Nicefield Hostel, which we have identified it as one of the hotspots in terms of reaching the number of guys who are not circumcised. And I can say up to so far we're making progress in terms of booking in the number of guys who are not circumcised.
So with the I Choose campaign, we started in 2015. And in 2015, we didn't do well as much as we did in 2016. In 2016, it was vibrant because we had youngsters who had joined us in the field to do the spade work. And they were able to attract more males to come to the site and for the mobile. So it was a brilliant and exciting venture to work with Live Moya on the I Choose campaign.
It was great for Live Moya to be part of this campaign and to assist SFH with reaching their set targets.
So for SFH, we do see the various successes based on the type of intelligence we were able to pull out of the implementation strategies and how our sites were going about doing that implementation. So Live Moya did bring the expertise into ensuring that we were able to document and then, re-implement into other areas of the program.